So good morning, all my dear students. So we are in a new day today, new hope, new aspiration, everything new, we have to assume. Though there are lots of the things going on around us, we have to remain reclusive and do the task. And today we will have a topic. The topic is safe motherhood. This topic demands an exaggerated discussion. We will discuss obviously on an appropriate manner. And to discuss on this topic, we do have a very decent presenter today. She is Shreyana Adhikari. She will be unfolding different facts about the safe motherhood. There are lots of the parameters to discuss on safe motherhood. So I hope it will be a good presentation, good discussion. So without a delay, I would like to request Shreyana if she can proceed ahead. I do see a couple of the people in the waiting list. Let me admit them first. And then, okay, I guess first I have to permit for the sharing of the screen. Okay, here you go, Shreyana. I guess now you can share the screen. Okay, yes, that is visible, we have to say. Your screen is visible, Shreyana. You can start the discussion.
Can you see my screen? You can see my screen, right?
Yes, Shreyana.
All right, then. So welcome to my presentation. It's a very fine morning. And so I hope you bear with me for this presentation. I'm very eager to start. So my topic is safe motherhood. So Sinla.
Okay, Shreyana. Okay, take your time. So I guess you people, you got the news in the early morning. We were hit by a earthquake. How many of you felt that?
Yes, sir.
So
Okay, Shreyana, carry on.
So my table of contents are. Sorry, it doesn't wait. Okay. Right. So my table of contents for day 1 is introduction, education and health services of safe motherhood, risk factor of pregnancy, and minor problems. Whereas minor and major problems will be discussed tomorrow by me. So, introduction. Safe motherhood is a concept of making process and real state of mother safer. It is considered to be very important aspect of reproductive health. Safe motherhood includes the overall process of taking care of a woman during pregnancy, delivery, childbirth, and puerperium generally 6 weeks after delivery period. Globally, awareness of the issue of maternal mortality began in 1987 AD at the Safe Motherhood Conference in Nairobi of Kenya, which drew the attention of the world and developed countries in particular to this issue and commitment to strive for reducing the mortality related to pregnancy and childbirth was obtained. Following the conference in Nairobi, Nepal government formulated the National Health Policy in 1991, which identified safe motherhood as a priority program and institutionalized safe motherhood as a primary health care. Similarly, the establishment of Safe Motherhood Task Force and the development of National Safe Motherhood Plan of Action 1994 to 1997 demonstrated step towards improving maternal health status in Nepal. Concept of safe motherhood. Safe motherhood means ensuring that all women have access to the information and services they need to go safely through pregnancy and childbirth. It refers to the protection of the mother and fetus during prenatal, natal, and postnatal period through safe motherhood initiatives. The ultimate goal of prenatal care is to detect any potential complication of pregnancy. Postnatal care includes the concern about the newborn baby care, mother's nutrition, breastfeeding, and family planning. It includes education on safe motherhood, pregnancy at an appropriate age, prenatal care, care during pregnancy, and counseling with focus on high risks of pregnancies. Promotion of maternal nutrition, adequate delivery assistance in all cases, provisions of obstetric emergencies, including referral services for pregnancy, childbirth, and abortion complications, postnatal care, care after childbirth, providing quality family planning service, and treatment of STIs. Why safe motherhood is important? It is important to overcome and eliminate the ongoing maternal health deaths in cities and villages. The common causes of maternal death. The causes of maternal mortality may be divided into three categories: social, medical, and availability of healthcare facilities. Social causes are early marriage and pregnancy, repeated childbirth, preference for sons, anemia, lack of information about danger signs and symptoms, and delay in referral. Medical causes or pregnancy related complications are obstructed labor, hemorrhage, antenatal during labor and postnatal, toxemia, infection or sepsis. Availability of healthcare facilities, lack of essential supplies and trained health personnel at the centers, non sympathetic attitude of health personnel, deficient medical treatment of complications, and inadequate action taken by medical personnel. Education and health services related to safe motherhood. A. Access to health facilities and nutritional diet. Due to geographical complications and many other reasons, there is no access to health centers, health posts, or hospitals in most of the rural areas. Consequently, women are deprived of medical facilities and consultation services during pregnancy and childbirth. NGOs and INGOs should work to provide health facilities. B. Adequate family support. A pregnant woman needs additional care, support, and affection for her better health. Her physical and mental state is weak during this period. So, a pregnant woman needs adequate care, support, and affection from her husband, her family members, and other relatives. Regular checkups and delivery from trained medical person or institutional delivery. A pregnant mother should visit for medical checkups at least 4 times, even in normal condition before childbirth. She must take iron, calcium, and other supplementary medicine regularly during pregnancy. Similarly, there is practice of childbirth at home without support of trained health worker in many communities in Nepal. It is always risky for both mother and child, as traditional practices are not based on modern medical science. The do's and don'ts during pregnancy to ensure sound maternal health and childbirth. Conventionally, a pregnant woman should go for prenatal checkup as per the schedule given below. First antenatal checkup right after conception. Monthly antenatal checkup from the first month till 7th month of conception. Fortnightly antenatal checkup from 8th months to 9 months of conception. Weekly antenatal checkup after 9 months of conception until delivery. Anytime emergency antenatal checkup is required in the case of complication. In case of first pregnancy, tetanus toxoid or TT injection should be given 2 doses intramuscularly. The first dose should be given anytime in the first 7 months of pregnancy, and the second dose should be given after 1 month of the first dose. Why is TT vaccine given? The basic and straightforward answer would be to prevent maternal and neonatal tetanus, MNT. The pregnancy do's. Some important things you should do during your pregnancy includes avoid all alcohol and tobacco or any recreational drugs. Avoid exposure to cleaning solvents, pesticides, lead, and mercury. Eat a balanced diet that includes folic acid, iron, and calcium. Maintain safe travel habits such as correct seatbelt usage. Set limits for yourself to reduce stress. Get enough sleep. Aim for 6 to 9 hours a day. Exercise regularly. The pregnancy don'ts. To keep the baby healthy, stay away from the following. Don't take any medicine unless your doctor approves it. Steer clear of vigorous activity that could involve a risk of falling or overheating. Don't eat unpasteurized milk and soft cheeses, fish high in mercury, or raw or uncooked foods, including fish and eggs. Stay away from heavy lifting and bending. Don't take hot baths or use saunas. High temperature can be harmful to the fetus or lead you to faint. Stay away from radiation. X-rays should be avoided during pregnancy. Risk factors during pregnancy. The woman's age is less than 18 years and above 35 years. For a woman to have been pregnant when she is less than 18 years means there is no proper amniotic fluid in her body, her uterus is not properly developed, and her pelvic is very weak. So there is a higher chances of miscarriage. And for a woman to have been pregnant after 35-year-olds means that all her good eggs are already gone, or they start to lose a certain potential, so which means your child could be born abnormal, or even stillbirth can occur. So the woman's weight is less than 40 kgs and above 80 kgs, height below 145 cm. The woman diagnosed with HIV, AIDS, cancer, diabetes, and other chronic diseases, which puts a severe risk to the mother's health. A woman is malnourished and she already has more number of children. If a woman is malnourished, then it would mean that her child would have severe low birth weight and could die within few days of delivery. A woman had given birth to twins in her previous pregnancy. The woman's last baby was born dead or died soon after birth. The woman's last baby was born less than 2 years ago. The woman is having the medicine that are harmful to the fetus. We have talked about the risk factors in pregnancy in our classes. It's in our books. But what we don't see are there are certain unavoidable and very rare life-threatening conditions in pregnancy that can actually destroy your entire experience of pregnancy if anything like this happens. So number one is sepsis. So sepsis is a condition in pregnancy. It is only a condition. It is not a problem. Sepsis is an infection that can develop before or after the baby has been delivered. Infections can be more severe in pregnancy, and after delivery, women may be at particular risk of infection of the womb or birth canal. Genital tract infections. Amniotic fluid embolism. Amniotic fluid is the liquid in which the baby floats in the womb. Amniotic fluid embolism is a very rare complication of pregnancy in which amniotic fluid, fetal starts, other cells enter the woman's bloodstream and trigger an allergic reaction. Women with this condition may collapse suddenly during the birth of their baby, and it often results in death of the mother. Preeclampsia. Preeclampsia is a pregnancy complication categorized by high blood pressure, signs of damage to other organ system, most often the liver and kidneys. Preeclampsia usually begins after 20 weeks of pregnancy in women whose blood pressure had been normal. Cardiac strokes. Pregnancy associated strokes are also the most common cause of serious long term disability after pregnancy. Risk factor for stroke include hypertensive disorder of pregnancy, such as preeclampsia and eclampsia and prothrombotic state, which increases the state of arterial and venous thrombosis. These conditions, such as stroke, cardiac complications, acute kidney failure, and preeclampsia, affect just under 5% of women during pregnancy and childbirth. So this is all my slides for day one. Day two will be more fun, I hope, because there will be minor and major problems and their discussions. So thank you for today. I hope to see you better tomorrow.
Okay, thank you, Shreyana. That was a very nice presentation, I have to say. There were lots of jargon words. I really enjoyed the presentation. So I can simply say very, very, very thank you, thank you, thank you. So now let's move towards the class. I guess we have a bunch of the people who enjoyed the presentation, and we are here to talk on plethora of the topic too. So yes, let's begin with Nagina Upreti. I guess she is Supriya Upreti. So Supriya, yes, I know you can't open up your video today, but yes, I don't guess you have problem with opening the audio, isn't it? So where she is? Supriya, can you listen to me? Or if is there any?
Sir.
Okay, yes, she is there. So yes, so can I ask few questions to you, Supriya?
Yes, sir.
So safe motherhood is simply the initiation taken by government of Nepal. It's not only limited within a particular country. This initiation has been taken in concern by different countries, and we do also have the initiation taken by the government of Nepal. Though these things will be discussed by Shreyana in later cases, but I am taking a step ahead to integrate with you as these things are more abundantly discussed in the classes. So Supriya, my question for you is, what do you think, what are the different types of initiatives taken by government of Nepal for ensurement of the safe motherhood?
The government of Nepal has launched approach for the safe motherhood. Some of them are AMA program, Sunolo Azadi, Nano Zola, and Posan Zola. Sir, I have to discuss in detail.
Yes, if you like, you can go through what does they means.
So AMA program is a program launched by the government of Nepal. So in AMA program, if the women who are pregnant, if they goes to hospital, then they will be provided some amount of money.
Mm.
And in Sunolo Azardin, it is a 1,000-day nutrition pack where the nutrition of baby is given to the mother. And Nanozola is a bag where the clothes of a mother, such as gown, is given for a mother and also for a baby. And Posanzola is a diet given for both mother and child.
Okay, thank you. Thank you, Supriya. There was a nice piece of discussion made by Supriya, which is absolutely appropriate or correct, I have to say. Now I will move with the next person to discuss. The next person will be Sudeep Dungana. Yes, Sudeep, can I talk to you?
Yes, sir.
So, like in colloquial language, also in our society, in the surrounding where do we live, there is a tendency of supporting a female and somehow consoling her that she should made her child the breastfeeding. The breastfeeding is the appropriate thing she should go with. And this initiation, this concept is prevalent in a society very wisely, isn't it? So can you come up with the explanation why there is a need of the breastfeeding immediately after the birth of the child?
So breastfeeding is very much important for a newly born baby, as well as for most of the babies till they become up to 3 to 4 months. It is very important to all of the babies. So first of all, the importance of breastfeeding is that it acts as an antibodies for all the diseases to the babies that might happen during the first 2 months after the birth of a baby, as well as the breastfeeding also helps to provide various nutrition for the babies and various products that can harm babies, as well as their body is not stabilized properly. So breastfeeding is a natural product of mother, and it helps to provide various nutrition bulbs to the baby, and it protects baby from various surrounding harms. Yes, sir.
Okay, yes, Sudeep, there was a nice discussion. Yes, obviously, the colostrum, the first milk, what we normally say, the colostrum contains all those nutrients which are necessary for a newborn baby. And if the newborn baby gets the colostrum, then he can build up the immunity, and lots of other vital functions that needs to be carried on is accomplished in a newborn baby. So due to that reasons, it is normally suggested for a newborn baby to breastfeed. And most important, the next important thing that we should not forget is, along with the nutritious material in the colostrum or the milk, we do also get antibodies. The antibodies which are produced in the mother according to the pathogens or the microorganisms which are prevalent around a baby and a mother herself. So due to that reason, when she breastfeed, then there is a transfer of those antibodies also. Normally, different forms of the antibodies are present. These antibodies through the milk, it transferred to the baby, and inside the baby's body, it helps to strengthen the immune system, and it helps to fight against the minor infection they are probably a baby is going to get in the future. So due to that reason, it is normally suggested that we should be going through the breastfeeding, and we should be taking special care of the colostrum for a newborn baby. There was a nice discussion made by Sudeep. Thank you, Sudeep. The now next discussion I will be making to discuss that topic. Whom should I go with? I guess I have to move with Isa Rizal. Isa Rizal, can I talk to you?
Yes, sir.
So just moment earlier, Shreyana discussed the risky factors of the pregnancy, and I guess she discussed the first word. The first sentence was the woman's age. If her age is less than 18 years and above the 35 years old, then that type of pregnancy would be risky. Then I do want to know the reason why. I do want to know the reason behind this mechanism. Why a person, why a female having a pregnancy under 18 and above 35 is risky? Okay, under 18, everybody knows, but above 35, what is the correlation between under 18 and above 35? Can you explain this bit?
Okay, sir. So, under the 18 years old, the woman is generally considered as a girls or a children. So, in this stage, the uterus and the vaginal canal and the hormones are not properly stimulated, such that the baby might not be invaded properly in the endometrial wall, or a child may born still, or there might occur a stillbirth. So after a 35 years old, the woman's generally the oxytocin hormones will not work properly. The contraction and relaxation of the uterus would will not be in a proper way. Along with the oxytocin hormone, there the many different types of the ovum is already been finished or wasted in the menstrual cycle till 35 years old. So during this 35 years old or after 35 years old, if a woman conceive a baby, then the baby might born with some kind of chromosomal abnormalities, or a baby might be miscarried. So after a 35 years old, if a woman conceive a baby, then it is also considered as a risky. Thank you, sir.
Okay, there was a nice piece of discussion made by Isa. Yes, exactly. Before 18, the uterus, the lining of the uterus, endometrium, we normally say, and then the vaginal canal is not developed well. Though a female is capable of the conception, she is capable of the conception, but the delivery scenario and the whole pregnancy period can be risky. So due to that reason, we have been saying that might be a risky conditions. And above 35 discussed by Isha, the most potential ovum are already used up, already cleared up during all those routine menstrual cycle that immediately begins from the age of 13, 14. And till 35, the most potential ovums are used up, cleared up, finished up, and then the remaining ovum, they poses a risk to a new baby. So if the same ovum are used, it can come with lots of other complications. Normally the chromosomal disorders, we normally say we do have Down syndrome, we do have Cushing syndrome, there are lots of complications, chromosomal abnormalities or the defect in the DNAs that we normally see. So it is normally suggested for a female, if she really wants to have a baby, then she have to plan before 35. After 35, she can do, but that can be a risky condition. Okay, there was a nice piece of discussion with you people. I guess we don't have much more time for today's discussion. So yes, with this, I would like to wrap today's class. And tomorrow we'll again have the presentation from Shreyana. Today it was part 1. Tomorrow we'll be taking part 2, and let's see up to where we can go for safe motherhood. Safe motherhood is a very, very, very important topic to discuss, to read, to generalize, to understand. For us, it's not only important from examination point of view, it is important for us for our real life experience also. If you go and if you are into a medical field or a paramedical field, then you will know, you will get this information in future. But if you are not into a medical or paramedical field in future, none of the subject is going to teach you about this. It is everything you will be getting from only school level. Hey, school level bahek पछि गएर हामी कहीं पनि पढ्दैनौं. Arts, education, lots of other areas, we will not read this topic. So it has been mandatorily kept inside the school curriculum so that you will be much more exposed to it. We will be much more habitual to it. For that case, it has been included. Yes, for tomorrow we will have the next series for the safe motherhood, and we'll discuss that matter in much more explanative way. We will come up with the conclusion, and then lots of things we'll be doing tomorrow. Yes, for today, I want to wrap this class here. Thank you everybody. I'm going to stop this recording.